Hello everyone, I am Dr. Shrikant. I am a pediatric gastroenterologist. Welcome to my channel. In this video, we will see about constipation in children less than 5 years of age. So constipation has, according to age, various causes and the treatment options are different. So that's why we try to classify and study according to the age group. So in this video, we'll discuss the constipation in less than 5 years of age. So if you're new here, please don't forget to subscribe my channel and please press the bell icon for notifications. So before moving on to constipation, let us see what is the normal stooling pattern in infants, in in babies, infants, and also in children of various age groups. So once the baby is born, the first stool, what we call is meconium, is passed within 24 hours. On an average, it is passed within 3 to 4 hours, but it has to be passed within 24 hours, at the most within 36 to 48 hours. Anything more than this range, more than 36 to 48 hours is definitely abnormal, and in general more than 24 hours itself is abnormal. So that is a alarming sign, and I'll discuss in the later part of the video what could be the reasons. So generally the infant or a baby passes stools, the blackish stools, which the baby would have accumulated in the mother's womb in the last trimester of pregnancy, and all those things comes out, and baby continues to pass this meconium for another 3 to 4 days, like the blackish tarry stools will be there, and subsequently the stools become yellowish and normal in consistency. The consistency is slightly towards semi-solid, right, with some flakes of stool material. So this is predominantly seen in breastfed child. But formula fed children can have slightly different stool consistency, but the frequency almost remains the same. For first 1 or 2 months, the frequency will be around 5 to 6 per day. Sometimes babies can pass every time they feed, so that is called exaggerated gastrocolic reflex. So that can happen, and this is how things proceed. And interestingly, when the baby is around 3 or 4 months, some babies may who are exclusively breastfed may not pass stools for 3-4 days also, who are passing more times in a day previously. So this is also again normal if there is no other symptoms such as stomach distension, vomiting, poor feeding, or crankiness. If nothing is there, so this is not a concern, and gradually it will again normalize. So and subsequently, when the solids are introduced at around 6 months of age, 5-6 months of age, so the stool pattern again, it can come back to 1 or 2 per day, and that's how it proceeds. And subsequently child usually passes, who are on typical Indian diet, around once or twice a day. So this, and rarely once in 2 days. But generally it is once per day, and generally it happens in the morning, because all the stool would have accumulated in the large colon, large intestine, the terminal part of the colon, that is rectum. And once the child gets up and starts moving, there will be initiation of defecation reflex, that is pooping reflex, and they feel like going, or at the most they may pass after having their breakfast. So this is how the normal stooling pattern goes on. So now let us see what is constipation. So constipation is a situation where child finds it difficult to pass stools, and because of that there are so many other symptoms associated with it. So this manifests as with following 3 predominant symptoms, that is infrequent stools. So it is change in the frequency as compared to the previous numbers. If the child is passing once per day and now child becomes once in 2 days or once in 3 days stooling frequency, then there is a change. So typically who are on Indian diet, so they pass one normal stool per day, but in Western literature and their diets are different, and sometimes they can pass once in 2 or 3 days, so that can be normal for them. But typical Indian diet, this is once per day is normal. So first thing in constipation is infrequent stools. Second thing is large caliber stools. The stool is so big, it can sometimes clog the toilet. So this is a second characteristics of constipation. Third thing is the stool which is very large and stretches the anal opening. It is very painful for the child to pass the stool, and sometimes there can be small tears and there can be blood droplets smearing the stool. So these are the 3 things which we say that child is constipated. So infrequent stools, a large caliber stool and painful stools. So when this happens, so it is very painful experience for the child. So child doesn't want to pass the stool. So what he or she does it. So only way is to withhold. That is the only way where child can prevent the painful experience. So child goes to a corner in the house, either behind the curtain or behind the table, when there is urge, and tries to withhold. Child tries to cross his or her legs so that and clenches the buttocks so that the stool doesn't come out. So this is called withholding behavior. So that's how the constipation, these are the typical features of the constipation what we see in children who are less than 5 years of age, and not so in very small babies like less than 6 months of age. So in this middle age group, so this is what we see. Apart from that, child can be having symptoms which are like related to constipation, such as stomach pain. Everything else may not be obvious, but child develops stomach pain. It may not be so severe, it goes on for weeks together, so that's how it remains. The other thing, they can be poor appetite. So because if the stomach is not empty, the intestines and the digestive system is not ready to accept food, so there is no hunger initiation, so this is not there. So because of that, they may not eat well, they may lose weight. So these are the other things, and child can be a bit irritable. So many other things will subsequently develop because of these things. So as I said, the constipation age, the reasons are different for various age groups. So predominantly, like since we are discussing in children who are less than 5 years of age, here again we can see it in 3 age categories. So less than 3 months are young infant, between 3 months to around 1 to 1.5 years, and more than 1.5 years to 5 years. So this is this age categorization is related to the onset of the symptoms. The first category, that is less than around 3 months of age. So as I mentioned in the initial part, the child has to pass the first stool, that is meconium, immediately after birth, that is at least within 24 hours. So if there is any delay, that means that the digestive system is probably not well developed. There can be issues with the neuronal wiring in the intestine. There is something called Hirschman's disease, where typically there will be delay in the passage of the meconium, that is first stool. And there can be other reasons as well, such as small anal opening, not properly placed anal opening, and many other things. We label it under congenital anatomical category. So in these, the constipation will start very soon, and this is somewhat a serious situation, requires proper investigation and treatment modalities. But fortunately, this is not a major category. So if you see 100 children of constipation who are less than 5 years of age, this accounts for only 1 or 2%. That is 1 or 2 children out of 100. Not so common. That's a good thing. But younger the age, these things can be commoner ones. So subsequently, beyond 3 months, when the child was normal, up to 3 months, child was like has passed meconium immediately after birth, and subsequently child was passing 1 or 2 or 3-4 times stools in a day. And around 4 or 5 months, when there is infrequent stools, the first thing is, as I mentioned again in the introductory video, that it can be just a normal variation where breastfed babies become bit infrequent during that age group. When there is no other symptoms, we generally tolerate up to 4 to 5 days or onset of some symptoms. So this can happen. So this is a normal variant, or we can call it as physiological variant of no concern. So the second category in this age group, that is the age group between 3 months to 1.5 years, so is related to change in the dietary habits. When there is any change, when there is any new food introduced, if there is any component of allergy, typically if there is milk allergy, some babies develop slowness of the intestine, and they can develop constipation. So this is the second reason. The first one is the congenital or anatomical cause. This is the second reason, like related to allergy. Again, this is not so common because maybe majority of the children are breastfed, or they are tolerant to most of the things, so not so common. But this is one of the reasons in this age category before the onset of toilet training, the next category which I'm going to discuss. So we saw 2 reasons so far according to the age. So third category is something related to toilet training. So this usually starts after 1 year of age. So very briefly about toilet training. Toilet training is the ability of the child to handle the defecation process on his or her own, on its own. So it has briefly has 4 steps. One is, first is to child has to understand the urge to pass stools. That is the first thing. When there is the pressure buildup, child has to understand. Second thing is, child should be able to undress or request to undress to pass stools. And child should not be passing in the diaper itself. That is not very right. And the fourth thing is, child should be able to squat like a person sitting in the Indian commode. This is called squatting. And fourth thing is, child should be able to pass it out while relaxing the anal opening. So these are the four steps. So I call it as UUSP. So understanding the clue, undressing, squatting, and passing stools by opening the anal sphincter. So this is called toilet training, and usually it happens when the child is physically mature to do this. And generally this happens around 1.5 years of age, when the child is able to walk around easily, child is able to squat easily. Between 1.5 to 2 years of age, when this developmental milestone has achieved. So if the child has delay in achieving these milestones, then there can be a bit delay, because child first has to walk and squat, so that physical maturity should be there. So when a child has attained this age, child should be able to pass on his own, and that child has to learn like any other skill. So this is a learned skill, like how child learns to walk, child learns to speak, child learn to understand things. Child should be able to learn these things, and it's a learned behavior where there is help required from the caregivers. They need to train the child to some extent. Some children are very easy to train, they understand, and parents may not even recognize that. And some children may have delay in understanding these things, but there can be variation. When the child is not toilet trained, again, child will not be able to pass stools normally, because as I said, child should be able to understand, squat, relax, and pass stools. If there is any problem in any of these steps, child will not be able to pass stools. There will be accumulation of the stools in the large intestine, that is colon, and those accumulated stools become larger and larger in size as the day progresses, as the child is not able to pass. And the larger stool, as I mentioned previously, will be very painful to pass. It can cause small injuries. Again, there can be small bleeding spots. And child tries to withhold, and the same cycle continues. Child withholds, the more stool accumulates, and more difficult. So this is how the cycle of constipation, vicious cycle of constipation, progresses. So this usually happens in children who are more than 1.5 years of age. So any child developing constipation beyond this age group usually is because of the poor or inadequate toilet training. So this is the third reason for constipation in the children who are less than 5 years of age. The next reason is related to the diet. Again, interestingly and fortunately, these days parents are very cautious about the diet, so we generally don't see this as one of the predominant cause. So this is mainly due to lack of enough water and lack of enough fiber in the diet. So one of the mistakes what happens in this age category is the children are predominantly fed with milk, because that would have been the diet of child when they are during their infancy, that is less than 1 year, and that continues. So when the child is predominantly on milk, so then it takes the space of fiber containing food items. So child doesn't contain fiber, and sometimes milk is constipating because of various reasons. One, we saw a component of allergy, and it doesn't have fiber. It takes away the space of other fiber containing diet. Child doesn't take other food when child is predominantly milk fed. So because of this, there is lack of fiber, and child can get constipation. So quickly, the fiber containing diets, foods in Indian diet are one is the whole grains, all whole grains, vegetables, and fruits. So please let me know if you need any special separate video on fiber containing diets which are recommended for children, that is preschool children less than 5 years of age, please put it in the comment box. So moving further, with this, we saw what are the reasons for constipation in children who are less than 5 years of age. So briefly, quick recap. So that is younger the age, it could be more of a developmental and congenital problem, improper neuronal wiring, Hirschsprung's, very young age, subsequently a component of allergy. Then a child who is beyond the toilet trainable age, that is more than 1.5 years, it is improper toilet training, and the diet that includes water and fiber. So these are the reasons for constipation. So this is very important because we need to understand why the child has developed constipation rather than blindly treating for the reason. So now let us see what are the management options we have. So first and foremost is to laxative. Use laxative, that is the stool softener, which soften the stools and helps the child pass stools easily. This is the first thing, and child will be on this for considerable amount of time. So this may improve the symptom, child may become normal, and obviously the parents, the caregivers become happy, but the treatment doesn't end here. This is just one beginning of the treatment. So this just helps the child relieve the symptoms. So next step is to really understand what is the reason for constipation. So only after addressing that, the problem will be solved. Otherwise, once we stop the laxative, the symptoms can come back because we have not addressed the symptoms. So younger the age, we look for probably if it is congenital reasons, Hirschsprung's, that will be taken care. Major chunk, 95% of the children are because of poor toilet training. So we have to initiate the toilet training process. So we need to teach the child the 4 steps of understanding, then undressing, and squatting, and passing stools in a sitting position, and with relaxing the anal opening. So every child has different ways of learning. We need to work along this. By age 1.5 to 2 years, they will be able to understand a bit, communicate with the child regarding the aspects of toileting, teach them how to sit. So these are the various ways. So but toilet training is very important. Without that, laxative may not work only when they are on. So you would have seen, like, once the laxatives are stopped, the symptoms come back because child has not learned the proper art and technique of passing stools, which is a learned behavior, like how a child learns how to cycle. So initially somebody needs to hold, encourage the child. Same way we give laxative and encourage and train them. So that's how they learn. And meanwhile, work on the diet as well, diet and water intake. That will also help. So viewers, thanks for watching this. I hope you understood and the aspects of constipation in children who are less than 5 years of age. If there are any questions and comments, please leave it in the comment box. And if you really liked it, please don't forget to press the like button and subscribe to my channel for further informative videos on digestive problems in children. Thank you.